Goedemorgen allemaal. Vandaag hebben we een heel leuk bezoek en dat is dokter Sabrina Fabi van San Diego. Een van de meest befaamde artsen in cosmetische chirurgie. En ze is vandaag hier in de kliniek. So, welcome Sabrina.
Thank you.
And today we're going to talk about the cosmetic field and how Sabrina is passionate about her work and what she would recommend. What kind of treatment and talking a bit about combination treatment and what her look will be on the future about cosmetic treatment in 5 years. So it's going to be a very interesting talk. Hi Sabrina, so can you introduce yourself a bit?
My name is Dr. Sabrina Fabi. I'm a board certified dermatologist. I practice in San Diego, California. I'm an assistant clinical professor at the University of California, San Diego, and I'm very actively involved in many clinical trials. So that we can push medicine forward. Many trials involving injectable fillers for the face as well as different lasers and devices.
Wow, yeah. So let's start where it starts. So where does your passion come from to choose for cosmetic dermatology?
My passion came from a passion in dermatology in general. I had a lot of acne issues and other skin conditions growing up, and I recognized the impact that something that is perceived as so superficial can have on the just overall self-confidence of somebody. And so being sensitive to that and wanting to help others that may have the same problems, I decided that I wanted to go into dermatology. But soon in dermatology residency, I recognized that I didn't have much patience for oral medications or topicals that take 3 to 6 months to have an effect. And I recognized that had brought a lot of frustration for my patients.
Yeah.
And so for that reason, I realized that lasers and devices could actually offer my patients a quicker result with more global effects, including the improvement in skin texture, redness, brown, more than just the ailment that brought them in. And so that made me want to go into cosmetic dermatology, mainly for my interest in laser and devices. And slowly with that, obviously I did a fellowship in it and I learned more about the injectable procedures and quickly facial anatomy and the pathophysiology of the aging face as well as the body became an interest and passion of mine.
Wow, it's quite interesting that you actually choose the field because of your own personal problem actually, and you want to improve your own skin, and by that you choose the path for the cosmetic. And what time during your residency did you notice that you want to go more cosmetic? Is that in your earlier or later?
It was probably quite early that I decided that I wanted to go into cosmetic dermatology. We treated a lot of veterans because part of our training was covering the VA, the Veteran Affairs Hospital, and many of them had a lot of precancerous lesions or cancerous lesions. They would have to come in every month to 2 months to have their lesions frozen or cut off, which I found to be quite
intense.
That's a lot of time, money, and scars. And it seemed like we weren't doing much to prevent or more globally treat them, do more field treatments. So I actually got involved early with photodynamic therapy. That was probably how it started for me. And then that quickly turned into using photodynamic therapy as a modality to treat acne. Again, because it can take 3 to 6 months for acne to improve with many of the oral and topical medications. And by then, many of my patients had scarring. So I felt like I wasn't doing my patients much of a service.
I understand.
By doing photodynamic therapy for their acne, within a month, you weren't only clearing them of cystic acne that could potentially leave them with scarring, but you were also treating the quality of their skin and improving some of the scarring they already had.
You're working in quite busy practice. So can you tell us how your day looked like?
And so I'm in a practice of cosmetic laser dermatology in San Diego, and it's quite a busy practice. I am blessed to have a team of 3 medical assistants. I typically see about 35 to 40 patients a day.
Wow, that's a lot.
And it's 100% cosmetic. We don't do any medical dermatology. And there we usually do, I'd say about 80% of my patients that I see in a day, I do actual treatments on. The other 20% are typically a consultation or a follow-up from a past procedure. And my day looks like educating those that come in for a consultation.
Yes.
Typically, we don't know what we don't know, and so patients are quite often bombarded with a lot of information online that they don't quite know how to decipher.
Yes. Yeah.
And how to determine what's real, what applies to them, what doesn't apply to them. And then sprinkled in between is a lot of marketing, promising solutions that they may not have even the problem
Yes.
for.
Yeah.
So it's educating them and empowering them to make the right decision, whether it's with me or with someone else. It doesn't matter, because I find that commonly people may, take that information and not decide to do treatment right away, and then later on
they keep it in their head.
They keep it on. They may have a bad experience somewhere else, going somewhere for cheaper at the spa or at the mall, and then they remember the education value that I may have brought them, and they come back. So it's establishing that trust and confidence.
Yes, that's actually how you build your practice, isn't it? To have the confidence and the trust from your patients, and then recommend them which treatment suits them the best.
Exactly.
So what you mentioned, that lots of patients come with questions that I saw on the internet, or the marketing that I saw on the internet, and sometimes you think that this treatment is what I need, but then they come with a picture. It's sometimes very difficult to tell that it's not the suitable treatment that they should start with.
Right, because they may not have the skin color for the laser that they saw advertisements on, or they may not have the facial anatomy to lend for a treatment with a skin tightening device or a particular filler. So they may not have the medical history that makes them a suitable candidate for maybe a biostimulatory agent. So there are many other things. Ultimately, it's still the practice of medicine. And so even though, yes, these are aesthetic procedures, they're aesthetic medical procedures, which require a basis of medical understanding and education, which you and I have done over 12 years of, to be able to really complement with the aesthetic procedures that we have available to us today.
I totally agree.
We do a lot of clinical trials in our practice, and so because of that, we usually have a little bit of a feel for what works, what doesn't, how to best combine those things, how to optimize the utilization of the technologies that are being investigated, and when they come to market, how to best use them for our patients. So it's really doing many clinical trials at the practice that keeps me up to date. And then I love to always kind of think about a little bit beyond what it is that we do. So I do like to publish a lot. And when I publish, I end up having to do quite a bit of a deep literature search on what's available, and through that I stay up to date with my medical evidence.
I read a couple of your paper, especially the one where you described the scaling for the wrinkles, the Fabi Bolton wrinkles. So Dr. Fabi is famous, so she has her wrinkle named after her. So, but it's quite interesting paper, because that's why you can standardize how you do your practice, and make it more qualitative paper about how you enhance the improvement of the wrinkle.
Right.
So it's quite an interesting paper.
Thank you.
I really enjoyed your session in Monaco about what you said, because in our field it's not only treatment of a wrinkle, but it's actually treatment of a whole person. And during your session about patient satisfaction, you mentioned that it's one of the key factors that will bring success in your clinic. And so how you maintain the patient satisfaction?
I think it's remembering, that it's the person comes in with a problem, but the problem is not the person, right? And so the wrinkle is not the person, the shadow is not the person. The person is still human, and we're all human, and so it's remembering that human element, whatever it may be that motivates that person to come in, I think is sometimes what we have to kind of decipher. Because the wrinkle has been there usually for 20 years. You know, the average age of the person that, you know, has jowling or laxity along the jawline that comes in is about 57, but those changes appeared much earlier than that. And so understanding the motivations, uncovering the motivations that bring people in commonly will give you a clue as to whether you could even meet their demand, right? Because it's understanding what brought them to your clinic, and that really takes a little bit more time than just a checklist or just a patient intake form. It takes getting to know the person that you're treating.
And that's not something that you know right away or can predict what kind of reason they come for. It's more a personal reason.
It's a personal reason, which I think then you need a relationship and you need some level of trust to be established in order to be able to elicit that. And then with that, you can gauge if the person has realistic expectations, what their expectations may be, and if you can meet them non-surgically. And if they are, because again, they read a lot on the internet, so then they start to believe that a bunch of filler, neuromodulator, or device is going to give them a surgical result, which is not always the case. And so then you may learn that they need to look good in a month for a particular event, for a reunion, for a daughter's wedding. And so it's understanding that human element that then allows you to bridge a gap to see if you can actually meet the expectation that they have. And if they don't, then you refer them out. At least I refer them out to facial plastic colleagues.
Sometimes it's not possible to give the result they want
in the time frame that they're looking for.
Definitely.
And that's okay. But I think you only really you can only get to those nuances by taking the time to know who you're meeting and who you're dealing with.
That's I totally agree, because that's the most important thing. You can better spend time, like 10 minutes more, to talk to your patients and understand why they're coming here, then do the treatment, and then have the discussion afterwards, isn't it?
That takes a lot more time.
I read your paper about the combination treatment, and you're definitely a pro for to do combination treatment. And which kind of combination treatment do you prefer?
So I always look at it like every tissue is aging as a function of age. Our skin, we're losing about 1% with collagen with turnover with each year of life. In addition, we're losing bone that begins at the age of 25, it becomes significant by 35. And then there's fat that's repositioning. So every tissue layer is aging. And I always tell my patients that your genetics will predispose you to maybe have one tissue age a little bit faster than others. You have wonderful bone structure, right? Not everybody may have that. And so then there's one tissue that starts to lag behind. And so I usually like to address that tissue plane first. But if somebody comes in later in life, it's typically every tissue that's aging. And so
like ladies around 50s, everything is aging.
And in that menopause period, the first 3 years of menopause is when you lose about 30% of your collagen turnover. So it's the most exponential collagen loss that one experiences is those first 3 years of going into menopause, which is why that change happens, and those people tend to be who comes into our practice. They're seeing the change, they don't recognize why it's happening. And so for those types of patients, I like to address the first tissue that's aging the most. But if all of them are aging, to give them a more comprehensive result, I typically like to combine either microfocus ultrasound, which stimulates new collagen production at multiple tissue planes, not just at one, because we're losing them at the level of the fascia that wraps around our muscle. We're losing it at the level of the fibrous septae that hold that skin onto underlying, muscle. And then we're also losing it at the level of the dermis, the second layer of our skin. And I like to start with that because it doesn't have any downtime, and it doesn't cause a lot of tissue swelling. And then immediately after, on that same day, I will typically do a little bit of filler along the bone to stimulate some of that, because there's now studies that show thickening of bone when you deposit HA or even calcium hydroxylapatite on bone itself.
Okay.
And it's the same concept that it's stimulating collagen type 1 because bone is made up of collagen type 1.
And do you do that especially on the cheeks or
I do that everywhere because we're using it everywhere. So I put that, now depending on your ethnicity, you may have more maxillary inward resorption if you're Native American or Asian. If you're Caucasian, it's usually more zygomatic, but the mandible typically resorbs 3 to 6 millimeters by the age of 60. And so putting a little bit along the jaw, the entire mandible, will support some of the skin that patients commonly come in complaining of, which is the neck and the jowls. And I do that immediately after. And then after that, I'll do a little bit of neuromodulator. Just
so your toxin, you do it actually
at the end, after the fillers,
okay.
And the reason I don't like to do it before microfocused ultrasound is I don't want to push, because I have to have good contact with the skin, and I don't want to push the transducer and spread
the toxin.
So I'll do it after. And we published on that, I want to say it was in May of 2016, Jean Carruthers and myself put together a consensus paper on that. I'm talking about how to combine and in what order on a particular day.
Okay, here in the clinic, I usually combine the hyaluronic acid with threads.
Okay.
So the threads treatment to do a little bit of lifting, and also because we're not losing only volume, but also the skin is sagging, and the threads stimulate collagen formation, and that's why you get a little bit of lifting. So it's a different approach, but can you comment on that? Do you have any experience with threads?
Yeah, we do the threads.
Yes.
I like threads on people that already have really good bone structure.
Yes, I understand.
And so those are patients that maybe their skin needs a little bit of repositioning. For the person that doesn't have good volume, or conversely has a lot of fats, I have not found it to be able to really lift.
Yes,
and
because the tissue is too heavy.
Too heavy. And so in those cases, that's when I prefer microfocused ultrasound. Now you can almost do both if you really want to, because at that point those patients, the integrity of their skin, it may not be as great of a quality of skin as it used to be. And so to thicken the skin a bit, you can use microfocused ultrasound. And then even immediately after,
do the threads. Okay.
Yeah.
And I think if you mentioned that, it can have a synergistic effect if you do both actually, because the threads will give the support for the collagen formation with the ultrasound.
Yes.
So, nice. Maybe we should try that.
Yeah.
So. I sometimes people say that when you do an invasive procedure or just a small procedure, I don't know whether you notice that in your practice, that it will enhance their physical health and their mental health, and it changed a lot in a person, like you're more self-confident but sometimes we get the critic that our field is very superficial, that you only treat the outside, and we know that that's not true. So can you comment a bit on that?
Yeah, so it's probably again what brought me into dermatology, because we recognize not even with just cosmetic injectables, but even with acne, the impact and the depression that it can induce. And this is a cutaneous or a skin condition, right? So, and that's in very young people. So there's absolutely an effect that skin conditions have on mental, on self-confidence and mood. And many studies, whether you have eczema or psoriasis, many skin conditions, this is already established medical knowledge. So that if you take it a bit further with aesthetic procedures that are more elective, where you're not necessarily treating a skin condition, but just the pathophysiology of aging, there are many different studies to support that there is an effect on mood, from neuromodulator treatments for the glands, right? They have found that in one study, 50% of people felt almost 50% happier when they were depressed. These are clinically depressed folks. And so that's better than some of the oral medications can give you that are intended to treat depression. So there's definitely a role. And the thought there is that if you can't frown, you can't give your brain the feedback to express the emotion associated with frustration or sadness. Similarly, there was a great study, it was the Harmony study that was done, which was the first prospective trial looking at a combination of injectables, both filler, neuromodulator, as well as a lash growth topical. And what they found was when they evaluated these patients using face Q, these questionnaires that were developed at Sloan Kettering to determine the improvement in overall mood, self-perception, confidence that somebody has from aesthetic procedures, that the quality of life, that improvement that a combination of neuromodulators and fillers had on patients was second to what a hip replacement.
Wow.
The quality of life difference that a hip replacement can offer somebody. So a hip replacement's number one, these procedures are number two. So there's definitely power, much more than something superficial that we perceive.
Yeah, it's one of the biggest rewards, isn't it? If your patient are coming back for the checkup and they're happier and more self-confidence, and it's great that you can compliment to that. So and sometimes if patients come quite often for a treatment, and how do you maintain to keep their unique features and don't make them all look the same?
Yeah, so this is a paper that I just wrote because what happens is many people come in looking or wanting to look natural. What is natural? We still have to define.
Yes.
But I would say it's probably patients not wanting to look like they've had something enhanced or done, right? And so, but those very same people, if you're in aesthetics for long enough, you'll notice that they will come in wanting more and more and more. So what happens? That what happens or this changes? And so if you look at the space of neuropsychology, and you look at body dysmorphic disorder, there is a concept of local and global processing. So their new baseline quickly becomes the enhanced baseline. And that enhanced baseline may still have a little bit of tear trough because that's how they always look. That was their own unique feature. Or had a little nasolabial fold because that was their own unique feature. Or had, a particular asymmetry in the lip because that was their own unique feature. And if you start, can we fix it? Of course we can fix it. But in fixing it, we take away that unique feature. And I think that's when it comes down to having an aesthetic doctor that you go to that's sensitive to those changes. And in my practice, I commonly look at their before and after photos. So that I don't start to drift with them, right? Because I also don't want to distort my patients' appearance. I want them to still look like their unique, Sally or Maria. I want them to still look like themselves, not just like everybody else in Southern California. And so that is something that I try to do. So once a year I go through their before and after photos from when they first came to see me to ensure that they still look like themselves. And to help them see that, because they forget what they started as, and so that serves as a standardized method to help them remember what they look like.
Yeah, I think that's a good thing to do when you're an aesthetic practitioner, that's to keep going back and look at the older pictures and not only looking for flaws, but something that's unique about your patient, and then try to accentuate that and don't try to make everything symmetrical and look all the same as an asset.
Agree.
I totally agree. So one of our last questions. What do you predict that's going to be one of the hot items in the near future, and how you think that the upcoming 5 years will look like? Because our field is growing quite fast, and sometimes it's difficult to keep up.
I think the concept of regenerative medicine is where we're going, especially with the younger demographic coming in to
the millennials.
To get these aesthetic procedures done. We definitely don't want to distort them and take away their unique features at such a young age when some of the changes aren't even significant of aging yet, right? These changes happen at 33, 35. And so, yes, the aging process is happening in those patients that are in their 20s and early 30s, but it's like it is to all of us. But it's not like you're trying to restore anything quite yet. And so what you're just trying to do is boost what's already there, right? Whether it's a little bit of collagen at the level of the dermis or a little bit of bone. And so I think that with that in mind, we may have more standardization of products like PRP and things that are growth factors that are intended to give the body a little bit more of
more natural recovery of the skin.
So that it just boosts what we already have without necessarily enhancing or distorting. And so I think that if that is the concept, then products will be developed and marketing will happen to address that. So regenerate what we have, not necessarily add or change.
Oh yeah, that's quite a good thing that will happen, isn't it? Because then you will focus more on growth factor and the regenerative possibility of your own skin and your own body, and that will give a more natural result anyway, because then you will keep the natural features.
Exactly.
Yeah. So, wow, Sabrina, thank you for your answers, and they are quite inspiring and very interesting. So we're gonna wrap up, and we will thank you, Sabrina, for visiting at the clinic, and I will see you later. Bye bye.